Meniscus and meniscus injury. Today we will be discussing in detail each and everything about meniscus. Meniscus is the shock absorber of the knee joint. The knee joint is the largest joint of the body. The knee joint is a joint composed between the thigh bone, which is the femur, and the shin bone, that is the tibia, and the meniscus is the structure in between. It acts as a shock absorber to prevent loading of the joint. This joint, the knee joint, has got two meniscus, the medial meniscus and the lateral meniscus. The medial meniscus bears around 80% of the body weight, whereas the lateral meniscus bears around 20% of the body weight. The medial meniscus is a C-shaped structure, whereas the lateral meniscus is more of a circular structure. If you see scientifically, on the medial side the movement is from front to back, that is the anterior-posterior, whereas on the lateral side the movement is from side to side, that is the pivoting movement. Because the loading of the knee is more on the medial side, therefore the chances of medial meniscus tears or medial meniscus injury is relatively higher than the lateral meniscus injury. Lateral meniscus tears do occur, but they do occur in combination with ligamentous injuries like ACL injuries and other ligamentous injuries. So whenever a patient has a ligament injury, there is a high chance that he might have a concomitant lateral meniscus injury. But if the patient has a primary ACL injury and he keeps on walking for a long time, there is a high chance that over the course of time he may develop a new medial meniscus tear. So this is the difference in mechanism of medial meniscus tear and the lateral meniscus tear. Now, as far as the anatomy is concerned, medial meniscus is formed by collagen fibers which are arranged in circumferential manner to provide hoop stresses to prevent loading. So what happens is when there is a loading, it is dissipated in a tangential manner. So basically it absorbs the load and dissipates it sideways. So this is basically the function of meniscus. The meniscus is concave on the top and flat on the bottom. Both the meniscus are attached in the front and in the back to the shin bone, that is the tibia, by what is called as a meniscus root. So every meniscus has a anterior root and a posterior root attachment. Meniscus word arises from a Greek word that is called as meniscos, that means crescent or the moon, half moon. So because this structure is in the shape of a half moon. So as I told you, meniscus is a very important structure inside the knee. So let's talk about the blood circulation inside the meniscus. The blood circulation inside the meniscus comes from the periphery. So there are blood vessels from outside which go inside the meniscus, and that's why meniscus has got red zone, red white zone and white zone, which are different zone which have different chances of healing and different chances of repairability. Those injuries which are in the red zone are relatively easier to repair, whereas those injuries which are in the white zone are usually difficult to repair. Many patients have asked us about symptoms of meniscus injury. So the most common symptoms of the meniscus injuries are: number one, pain. Now this pain can be variable, it can be very severe, but it can be mild also, and the pain can be continuous in some patients, whereas it can be episodic in some patients, and in some patients it may be recurrent. That means that some days the patients are good, some days he is bad. The pain may occur or disappear after doing some physiotherapy or exercise. The pain may appear after doing some sporting activities. So the pain is there, but exact characteristic of pain may vary. Although most of the patients do complain that the pain is increased with full flexion and full extension of the knee joint. Second most common symptom is locking. Now what is locking? Locking is basically a lock kind of sensation which occurs in some patients, and what it essentially means is the knee is jammed into one position and the patient is not able to extend or bend the knee. The knee is jammed or locked into some particular position. So locking is also a common symptom. In some patients it may be a giving away sensation. So some patients may feel a giving away sensation. They may lose balance when they are walking because of the meniscus tear. In some patients the range of motion may be decreased. So the patient may not be able to move the knee completely straight or bend the knee completely because of the meniscus tear. Knee stiffness is also an important feature. Swelling in the knee is a very important symptom of meniscus injury in the knee. So occasionally patients do report of water in the knee or water pooling inside the knee, feeling of heaviness or feeling of fullness inside the knee, and this is basically because of the effusion in the knee. So what it happens is like that, if there is a small stone which fall into your eye, you may have noticed that a lot of water comes out of your eye. So similarly, if there is a injury in the meniscus, if there is a meniscus tear, there is reactive effusion or reactive filling of water inside the knee, and that causes knee swelling. So meniscus injury is a very, very important cause of knee swelling. So many patients ask us, okay, how do you identify that the patient has a meniscus injury? So meniscus tears can be diagnosed by two main tests. The first test is called as a McMurray's test, which is performed with the patient in a supine or a lying down position, and the second important test is a Apley's test. Now Apley's test is the same test, but it is performed with the patient on the prone position, that is the patient lying down on his belly. Both of these tests basically are twisting knee tests. So what we do is we twist the knee and we see if the pain is reproduced or not. So if there is a meniscus injury, twisting movement of the knee joint will produce pain. But both of these tests are around 80 to 90% sensitive for diagnosis. So they are not confirmatory tests, they will just give you an idea that the patient may have a meniscus injury. For confirmation of meniscus tear, a MRI examination is mandatory. A MRI test is an excellent test to diagnose a meniscus injury inside the knee. So if you have any kind of doubt in your mind that you may have a meniscus injury, it is better that you get an MRI scan of your knee done. MRI scan is very sensitive and it can pick up around 98 to 99% of meniscus injuries inside your knee joint. But there is a drawback of MRI, that MRI is very, very sensitive and occasionally it can pick up small signals which are actually not tears. So you must be well aware that if your MRI scan shows that you have a grade 1 signal changes inside the meniscus, then it is not a meniscus tear and you don't need a surgical intervention or an arthroscopy for these particular lesions. You need an arthroscopic surgery only if you have a grade 3 medial meniscus or lateral meniscal signals. So grade 3 meniscal signals actually means that you have a meniscal tear and you need an arthroscopic procedure or arthroscopic surgery. But if you have grade 1, there is no need of any surgical procedure. If you have a grade 2 meniscus injury or meniscus signal changes, we recommend that you definitely show to a qualified, experienced arthroscopic surgeon. He will be able to give you a good idea about what needs to be done next. He will be able to tell you whether you need a surgery or not. In our experience, normally 80% of the patients will not need an arthroscopic intervention. Around 20% of these patients may need an arthroscopic intervention. Now many patients have asked us that and there is a popular belief in the community, in the population, that a meniscus surgery leads to arthritis. So if you remove the meniscus, the knee will be damaged in future. So I would like to clear this stand. So now if you have a meniscus injury or a meniscus tear which has led to the tear in the meniscus, you have got 3 treatment options with you. First treatment option is a treatment of physiotherapy and medications and continuing like that. That is the first option. This you can do under the supervision of any physiotherapist or any orthopedic surgeon. They can prescribe you some tablets and they can prescribe you some exercises and you can continue with that. What happens is, as I told you, that like a stone in your eye, the meniscus will be free and that may cause more degeneration, more damage to your knee in the future. The second option you have is a procedure which is called as a partial medial meniscectomy. This procedure can be performed by a orthopedic surgeon who have a basic training in arthroscopic surgery. So any surgeon who has got a basic training in arthroscopic surgery can perform a procedure which is called as a partial medial meniscectomy, in which the portion of the meniscus which is torn is just trimmed off and removed. And the third option is the latest and the best technique for a meniscus injury, and that is basically repairing of the meniscus tear with some special devices and special sutures with special techniques. So that is called as a meniscus repair surgery, and this is the most advanced surgery. So we were talking about the damage or chances of arthritis or osteoarthritis or knee damage in the future. So the chances of damage in the knee or knee osteoarthritis is maximum in the first group, that is the group in which no intervention is done. If you get an arthroscopy and a partial medial meniscectomy done, the chances of osteoarthritis are reduced. And if you get a repaired meniscus surgery, if you get a meniscus repair surgery done, the chances of osteoarthritis are minimum in the patients in which meniscus repair surgery has been done, have the best long-term outcomes and least chances of osteoarthritis in the future. Friends, if you have a meniscus injury and if you want to talk to me about a first aid, so the basic first aid or the basic initial treatment of the meniscus tear is basically rest. You can apply ice, you can do cold packs or ice packs in these patients. It is advisable to keep your limb at an elevated position, and you can apply a crab bandage or a brace for comfort of the patient. So this is the first aid. If you sustain any meniscus injury, this is the first aid that you should do. Now coming to the surgical options. So as I told you, the two options that you have is an arthroscopic procedure and trimming of the meniscus, which is called as a partial medial meniscectomy, and this is a common procedure which can be performed by any basic trained arthroscopic surgeon. The other advanced procedure is called as a meniscus repair procedure, which is usually performed at a higher centers and centers which are performing arthroscopic surgery in higher numbers. Now meniscus repair surgeries are of different types. The three major types of meniscus repair surgeries are inside out repair, outside in repair, and all inside repair. We will cover these one by one. Inside out tear repair is a standard or a gold standard technique in which there are multiple long needles which are used to repair the meniscus from inside to outside. This is a very good technique with very good fixation, but the only drawback of this technique is you need to make an incision on the back of your knee for repair of the meniscus in these particular scenarios, and we need to repair the meniscus from the back, and this usually causes a scar on the posterior aspect of your knee joint. So the scar will be around in this area, so you may have a scar in this area in this technique. The second technique is an outside in technique. So this is a technique which is done by smaller needles, and these are from out to in. So you put some needles from the outside and you put it inside and take multiple sutures, and this technique is usually used for the anterior part and the body of the meniscus. Now we come to the latest invention and latest technique in the meniscus repair surgery, and this is the meniscus repair devices, and this is called as a all inside meniscus repair techniques. In this particular techniques, there are special ready-made devices which are available from different companies, and through which we use specific devices to lock that meniscus tear into its position. So the repair is done from the arthroscopic technique only, no extra additional incision is required, and this leads to a very cosmetic appearing nice repair. The only drawback of this particular technique is the cost, because if we are using a all inside technique to repair the meniscus, the cost of the surgery can be phenomenally high, because sometimes we might have to use 2, 3, 4, 5, 7, 8 meniscal repair devices, and that will increase the cost of your surgical procedure a hell lot. So cost is a restricting feature in this repair, but if cost is not the constraint, then this is a very good technique. All inside the suture repair is the very good meniscus repair technique. Now I would like to just summarize different brands of meniscus repair devices that are available in the market. The prototype and the most old suture repair devices is from Smith & Nephew company, and that is called as a Fast Fix brand. It comes into three patterns: a reverse curved, a curved and a straight one. And now there is an advanced version available which is called as a Fast Fix 360 degree. This is a single use single suture device, very handy, easy to use, and very ergonomic kind of a device, and it is an old device with a long success history, and we use it quite often. Second is a Sequent Device from Linvatec. So this is a specific device because it is the only device which can put up continuous sutures. So it can put not interrupted but multiple sutures and continuous sutures. It is available in two dimensions, 3 shots and 7 shots, and this is useful because it can put multiple anchors, and you can take a running or a continuous stitch with this technique. Arthrex company has got a cinch kind of a device. It is also interrupted kind of a suture repair device, very good, again very handy and useful for the surgeon. Stryker company has come up with a AIR device that is called as a all inside repair device. It is again a very good device, a very handy, very ergonomic, active deployment device, white thread and very small buttons on the back. You just have to push the trigger 2 times and you get the meniscus repair locked into the position. Similarly, Depew Mytech has come up with omnispan and 2-span kind of a devices. These are they are shaped like a gun, and they again, with pressing of the trigger, you can repair the meniscus into their positions very nicely. So this is again a very nice device to repair the meniscus. And now I'll come to the recent advancement that is called as an all suture all inside repair devices. This is by Zimmer Biomat, and this device is basically a all suture device. So there is no plastic material into it. It is made up of all through of a suture material only. It's a 2.0 UHMWP suture and totally made up of suture, no plastic material, no foreign material inside. Very safe, very ergonomic and very precision based device. So you can use any of these devices. The gold standard is you should try to repair the meniscus as much as possible, because if you repair the meniscus, you save the meniscus and you save the knee. You prolong the life of the knee, and the native knee we all know is much better than a replaced knee joint. Coming up to the meniscus root repair, this is a newer dimension. If you have a meniscus root tear, that means that the meniscus is avulsed from its attachment on the tibia then it is imperative that we do a meniscus root repair. So this is again an arthroscopic surgery. We perform it with the arthroscopic technique. We pass up multiple sutures, take bites into the meniscus and tie it over the suture bridge. So these are called as a suture pull-through technique of meniscus root repair. Friends, if you like to see any of these techniques live, you can go and see our videos which are dedicatedly made for meniscus repair, meniscus root repairs. We have live surgeries in which we have demonstrated all these techniques, and if you want to see these videos in Hindi also, they are available very easily on the YouTube. Friends, if you have any more doubts or any more questions regarding meniscus tears or meniscus injury, please free to write us on the comment box. I would also advise you to share this video with your near and dear ones, your parents, your friends who have problems in their knee joints, so they can be benefited. And if you want to take a online consultation, that facility is also available. Thanks a lot.